Hi friends, good evening and welcome to my channel. Friends, daily we are seeing important points for exam. Today's topic is from midwifery section, that is fetal development we are seeing today. We will see the periods of development. Pre-embryonic period, that is first 2 weeks after conception is pre-embryonic period, and embryonic period, that is before after pre-embryonic period there is embryonic period. Approximately 8 week after conception is embryonic period, and fetal period means 9 weeks after conception to birth is fetal period. 9 week after conception to birth is fetal period. So pre-embryonic period, embryonic period and fetal period. And next we can see the fetal development. So first week, that is free floating blastocyst, and interstitial implantation begins at first week. Blastocyst means by 5th day after fertilization there is the fertilized ovum form blastocyst, that is after 16 cell stage morula, then it form blastocyst on first week. And 2 to 3 week, embryo is 1.5 to 2 millimeter in length, and lung bud appears in 2 to 3 weeks, and fetal heart and fetoplacental circulation starts. Fetal heart and fetoplacental circulation start at 2 to 3 week, and heart is tubular in shape and begins to beat. So heart is begins to beat at 2 to 3 weeks, and neural plate become brain and spinal cord at 2 to 3 weeks. Okay, and next point, at 4 to 6 week, embryo is 0.4 to 0.5 centimeter length, and embryo is 0.4 gram weight, and double heart chambers are visible at 4 to 6 week. Double heart chambers are visible at 4 to 6 week, and heart is beating, lymph bud forms, and formation of phase. It's an important point, formation of phase at 4 to 6 week. And next stage of development is at 6 to 8 week. Embryo is 3 centimeter length, and weight is 2 gram, and it begins to fuse at 6 to 8 week, and embryo can be recognized as human. So embryo can be recognized as human at 6 to 8 weeks. It's an important question. So embryo can be recognized as human at 6 to 8 weeks. All major structures are formed, and circulatory system through umbilical cord. Umbilical cord is well established at 8th week. So circulatory system through umbilical cord is well established at 8th week. And the next development is 8 to 12 week. Fetus is 6 to 9 centimeter length and 19 gram weight, and face is well formed at 8 to 12 week, and limb buds are long and slender, and kidney begins to form urine. It's an important point, kidney begins to form urine at 8 to 12 week, and spontaneous movement occurs to the fetus, and heartbeat is detected by Doppler transducer between 10 to 12 weeks. Okay, heartbeat is detected by Doppler at 10 to 12 weeks, and sex is visually recognizable at 8 to 12 week, and external genitalia also developed. Okay, these are all the changes in 8 to 12 week. And 12 to 16 week, that is 12 till 12 week is that one, and after 12 week to 16 week, fetus is 11.5 to 13.5 centimeter length, and weight is 100 gram, and active movement are present at till from 12 to 16 weeks, and lanugo hairs begins to develop, that is body hairs begins to develop, and skeletal ossification occurs at 12 to 16 weeks. And the next developmental stage is 16 to 20 weeks. Fetus is 16 to 18.5 centimeter length and 300 gram weight, and lanugo covers the entire body at 16 to 20 weeks. Okay, and fetus has nails, and muscles are developed at 16 to 20 weeks, and heartbeat is detected by regular fetoscope at 16 to 20 weeks. So heartbeat is detected by fetoscope at 16 to 20 weeks. And 20 to 24 week, fetal length is 23 centimeter and weight is 600 gram, and hair on head is well formed. In head, hair is well formed, and skin reddish and wrinkled, and reflex hand grabs function occurs, and caseosa cover the entire body. That is the white pigment that cover the entire body at 20 to 24 week, and fetus has ability to heal. By 24 to 28 week, fetus is length is 27 centimeter length and weight is 1100 gram, and limbs are well flexed, that is upper and lower limbs are well flexed, and brain is developing rapidly, and eyelids open and close. So eyelids open and close at 24 to 28 week, and lungs are well developed and sufficiently. So if born, neonate can breathe at this time. So if the fetus is born at this time, they can able to breathe. And 28 to 32 weeks, fetus is 31 centimeter length and weight is 1.8 to 2.1 gram weight, and bone are fully developed during this period, and subcutaneous fat has collected. Subcutaneous fat occurs all over the body, and lecithin sphingomyelin ratio is 1.2 to 1.2 is to 1 during the time of 28 to 32 weeks. And next, 32 to 36 week, fetus is 35 centimeter length and the weight is 2.2 to 2.9 kilogram, that is 2200 to 2900 gram, and skin is pink and body is round, and laringo disappears, that is body hairs disappears, and lecithin sphingomyelin ratio is greater than 2 is to 1. Okay, and the next developmental stage, 36 to 40 weeks, fetus is ready to deliver, that is the weight is average weight of a baby is 2.5 to 3 kg, that is 2.5 to 3 kg, that is 2500 to 3000 gram, and solar, that is plantar creases run down to lower heel, and testis in scrotum descend to scrotum, and labia majora in girl baby is well developed. Lanigo is present on upper arm. Lanigo present on upper arm and shoulder, remaining all over the body. The lanigo disappears, and fingernails extend beyond fingertips. So fingernails come down at 36 to 40 weeks. These are the fetal development from 1st to 40 weeks.